Hey everybody, and welcome back to my channel. Today we're going to talk about trauma and what it is. We're going to have a little bit of psychoeducation on it. So trauma is complicated. It can be obvious with a clear cause and symptoms that seem or make sense, or trauma can be buried beneath depression, anxiety, and anger without any recognizable origin. Okay, the caused event may have occurred a week ago or half a century in the past. So to help survivors of trauma make sense of what they're experiencing, psychoeducation is a natural place to begin. Psychoeducation can help by normalizing the experience of trauma. Only by giving a name to the enemy, it can help my clients build the confidence they need to know that they can get better. So that's what we're going to do today. Stay tuned, okay? Okay, what is trauma? Trauma is a powerful emotional response to a distressful event, such as war, an accident, an unexpected loss of a loved one, or abuse. It can continue to cause both emotional and physical symptoms for many years, even after the event has concluded. So these are the risk factors with trauma. The traumatic experience was unexpected. The victim has experienced past traumas. The experience happened repeatedly or over a long period of time. The trauma occurred during childhood. The trauma occurred and having the victim feeling helpless during the experience, and trauma occurred with the victim dealing with other major stressors unrelated to the trauma. Okay, so symptoms of trauma everyone's experience with trauma, by the way, is unique. So some people will develop early symptoms, some people will develop every symptom, while others develop very few very later on. The following list of symptoms is not comprehensive, and it should not be used to form a diagnosis, by the way. But here are the symptoms. Avoidance of trauma reminders, including memories, flashbacks to the traumatic event, exaggerated startled response, distressing dreams and other sleep problems, irritability, anger, and other negative emotions, self-blame regarding the traumatic event. Next, we're going to talk about treating trauma. Treating trauma. Okay, so there is cognitive behavioral therapy is what I do. So it's a common and well-supported treatment for trauma disorders. CBT works by identifying and challenging unhealthy thinking patterns that contribute to the symptoms of trauma. The benefits of CBT can be long-lasting. Then there's exposure therapy. During exposure therapy, the patient is exposed to reminders of their trauma in a gradual and safe way. With enough exposure, the trauma begins to lose its emotional power and symptoms diminish. Exposure therapies have extensive research support. Then there's medication. Medication may be used to manage the symptoms of trauma, such as anxiety and depression and insomnia. Medication can be especially valuable when a person's symptoms are so intense that they are unable to participate in any kind of psychotherapy. And then obviously there's other treatments, many other treatments such as narrative exposure therapy, eye movement desensitization, and reprocessing. Where was I? I was at, desensitization and reprocessing, EMDR, and group therapy all have been found to be helpful for survivors of trauma. It's always okay to ask your therapist what treatments they use, but definitely if you're experiencing trauma, definitely go to your therapist and ask for some psychoeducation. Okay, I hope this video was helpful. Let me know if you agree to disagree. Comment on the sections, leave me a message on any of my social media platforms, and thank you so much. You guys have a blessed day.